Hi. Sorry, I thought I'd do this outside, but the train's just gone past just as I turned it on. We'll see how it goes, and we're learning from this. And if this doesn't, if there's a lot of background noise, I might not do it outside again. Right. Hello. 11 o'clock ish. So Q&A. Got the comments will appear, so I think you can ask questions if you want, if anyone's there. But I've got some questions that have been asked in the week, which is great. Thanks very much. And so, as promised, I will go through the questions that you ask. And if you have any questions that come from this, then please post them or email them to me, and then I will answer them next time, or any questions that you got. Anyway, a lot of the comments seem to be related to the last post, which was about the flying with implants. Very happy to answer questions on any topic. So happy to talk about anything really, but these questions seem to be mainly related to that flying and post-op care and recovery and things. So we've got a question here from Lisa, who in Portugal. So I know I have seen you before in the clinic, and I know you're worried about having surgery because you're from so far away. And I've got to say, and I think I probably said this to you in the clinic, a lot of people do it the other way. They go abroad for surgery, and I do advise them, and I write about this in my book, about going abroad for surgery and the sort of dangers of cosmetic surgery tourism. I can see the appeal, but there you've got to be a bit careful about doing that sort of thing. People are joined. Hello. So the same thing goes the other way. So when I do see people from overseas or people who live far away, I do say, look, there's probably pretty good surgeons where you are, and so there is an element to say, should I have surgery at home? Anyway, so that's the first thing to say. But I know you do come over here quite a lot, so it fits with you, and might be that you've got family here, but anyway, if you've got family in the UK and things, then it is okay. But so a few questions here. First of all, pre-op, how soon prior to the surgery does it have to be done? I think the hospital like it like even a week or two before, but a lot of people, if they're fit and healthy, a lot of the work can be done over the phone, and we do try and accommodate people if we can. So you can potentially have it done quite soon prior to the surgery, day before, maybe even a morning of surgery. It's absolutely fine with me, and most of the pre-op tests are actually for the hospital rather than for me. So we used to not do pre-op at all and just see people on the ward on the day of surgery and do the tests then, and that's fine by me. But it's mainly the hospitals that want the pre-op tests. But if you are living away and can't come to the hospital the week before, we can accommodate that, and maybe day before or even day of, and do most of the stuff on the phone, assuming that there's no medical problems or issues. So hopefully we can work around that. The other thing, if there is any tests to be done, sometimes we organise them to be done locally and then sent to the hospital, but that usually is in this country. I don't know if that would work in Portugal. Luggage and weight if you're going back with a friend afterwards, and post-op checks. So both those questions. Post-op checks normally do 1 week. Pretty much, to be honest with you, pretty much most operations that I do, my post-op regime is that I see people at a week. I take the dressings off at a week. Hopefully you won't need any other dressings after that, and then I see you 6 weeks, 3 months, 6 months, 12 months, and then a yearly follow-up. Sort of broadly speaking, so that's the post-op regime that I would see you at 1 week, then I'd see you at 6 weeks. Having said that, if you are going away, if you're going back to Portugal or something, then I would, ideally, if you can stay around for a couple of weeks, 2 or 3 weeks, because although I might not see you until 6 weeks, if you have any problems, if you have any issues, scars a little bit red, or there's some problems, it's nice if you are still close, because then I can see you if there's a problem. Whereas if you're back in Portugal, it's more difficult. There normally aren't any problems, but there might be niggles and things, and it's just gives me peace of mind and gives you peace of mind. So I would advise you to stay in the country for a couple of weeks after the surgery if you can. Luggage and weight, you'll the first couple of weeks I think it will be uncomfortable. So if you're going to fly back in the first couple of weeks, I think it will be uncomfortable to carry stuff. And also Claire, you were asking about 10 weeks post-op, carrying bags and things like that. First couple of weeks, I wouldn't do too much carrying. I think it's fine to be up and about. I think it's fine to be moving around and what have you. But certainly if you've got implants in, the more you move your arms and you exercise your arms, it's putting power through your arms really. Moving's fine. I think it's moving because you don't want to get your shoulders stiff and things. But putting power through your arms is something that I think you should avoid, because anytime you're exercising those muscles, there's the interface between the muscle and the implant. Whether it's behind or above the muscle, it's still next to the muscle, either side. And so you're just going to make it swell. And the more it swells, the longer it takes to settle. So I normally say 4 to 6 weeks for anything like heavy. It's difficult because a lot of people have children. So if you have children, you can't really not lift your child for 4 to 6 weeks, so you have to compromise with that, and so you might just sit in a chair and lift your child up and just have to sort of compromise somehow if you have got children. But if you are going on holiday or lifting heavy bags, then I would say that 4 to 6 weeks is normal. Also, you want to have a nice time on holiday and you don't really want to be uncomfortable and things, so 4 to 6 weeks I would say for that. If you are just going home, if you live in Portugal and you're going home, then you probably could go back after 2 weeks. I think you still will be a bit uncomfortable and it will make it swell, but you have to balance that. You might say, well, look, I don't want to stay in the UK for a month just because it's going to swell a bit. And this comes back to Claire's question. She's 10 weeks post-op. I mean, after another train, maybe you can't hear it, I don't know. After a couple of months, after 2 or 3 months, then you can start doing normal stuff. So Claire, you can do normal stuff, you can do anything you want. But, I always say but, listen to your body. If it's uncomfortable, if it swells up, back off. Because if it swells up, you're probably not going to do any harm at this stage. 10 weeks, you're not going to do any harm. Touch wood. But, you shouldn't do anything as long as you're sensible, But if you do overdo it, if you do have to lift heavy bags and you do stuff, you'll make it swell and then it'll just take longer to settle. So it's just a question of being, trying to be sensible and trying to listen to your body. And if you find it's uncomfortable and it swells up, just back off and let the swelling go. I've got a question coming in live. I hope that question stays there. Is bruising on the ribs normal? My right wrist. Excellent. Okay. Yes, Teresa, I will answer that question about the bruising and the right being bigger. Another question here about boob greed profile, not wanting to be too small. So I see a lot of this about people worry that they're going to be too small, and everyone says I should go bigger, and it's tough. It's really tough. Choosing implants is tough, and I say to people, come back to the clinic as often as you want. We'll go over it as often as you want, because yes, most people that I see say they wish they'd gone a bit bigger. I would say that the profile you've written here about the profile's really key. And you have to get the profile right, and you have to get the width. The width and the profile are the key things, because that's what gives you a good look. And that's what I'm trying to do. I'm trying to give you a good look that's in proportion with your frame, that fits. And many people say to me they wish they'd gone a bit bigger. That's okay, because it looks good. And if it had gone a bit bigger, it might not have looked so good. But it is tough. It is tough, that's what I'll say, and we have to have this conversation, and we have to have the conversation pre-op, because it's better to have it pre-op, so then you're prepared. You don't want to be having the conversation post-op. I don't want to be saying to you, oh yeah, but if you had bigger implants, it might not have looked so good. You need to be prepared for that pre-op, so be prepared for the sort of volume that will fit your frame, and check that you're happy with that, because you might not be happy with that, and you might want a bigger volume, and that's fine. You can have a bigger implant, but it might not look so good. But you might say, well, actually, I'm happy with that look, and that's good for me, and I want the bigger volume. Fine. It's all about pre-op discussions. That's why I say, look, come back to clinic as often as you want. Be comfortable with the decision before you have the surgery, because it's your body and it's your result. It's not my result. So what I think is a good result is not important. My good results are when patients are happy. That's a good result. So yeah, absolutely suitable for your frame. FDA approved implants, yes, absolutely fine. You can have an FDA approved implant. and that's fine. And there's a few Allergan, Mentor, they're FDA approved, and I'm very happy to use those. I don't routinely use them. I routinely use Nagor silicone implants and Polytech polyurethane implants. No polyurethane implants are FDA approved. Polyurethane implants are not FDA approved, so if you want polyurethane, then you can't. Then none of them are. So, but if you want silicone, then that's absolutely fine. It doesn't. I'm happy not using FDA approved because all the implants are CE marked. Everything has to be CE marked, the polyurethane ones and everything, because we're using it in this country. But yeah, a lot of people want FDA. I mean, FDA is it's Food and Drug Administration. It's an American standard that a lot of people, I think, on the internet read and think it's a good thing, and it is very stringent, the criteria to be FDA approved, and you might think that's good. For me, I think they're actually potentially withholding a lot of implants from patients because I think they're a bit too stringent, and certainly with polyurethane, and I think opening up the market of using all of the makes of implants, I think is there's a lot to be said for that. But if you really want an FDA approved implant, I'm okay with that. Not tied to any make of implant, and we can certainly talk about that. So Therese, you're asking about bruising on the ribs, and right breast is bigger. So you're quite soon. I think it's, what is it, 10 days, a week? So yes, absolutely, bruising is normal. Now we're talking about breast reduction. So breast reduction is a bigger operation than breast implants. A lot of people think breast surgery, tie it all into one. A breast reduction is a big operation, and it takes a while for you to really get back from it. The first week or two, I'm just looking for healing. I just want things to heal up. Not even a week. Okay, sorry. Okay, right, okay. There you go. So it's not even a week. So, well, yes. So, yes, it's a big operation, and the first 1, 2, even 3 weeks, you just want to get things healed. So, you just want to get those wounds healed up. I'll take on board when people say this nipple's higher, this nipple's bigger, smaller, this breast is larger or smaller. All sorts of things happen in the first few weeks, and I say to people, don't worry about it, because it's not your final result. It's going to take a few months before you see your final result. So don't worry. Whenever you do things to both sides, they settle differently for whatever reason. I don't know why, and you can say that I'm right-handed and I do more on my right hand, so therefore my right side swells. But a lot of people who are right-handed, their left side swells. So I don't think it's necessarily that, unless you've done an awful lot on your right side, which I suspect you haven't if you're only a week post-op. So I don't think it's necessarily because you're right-handed, or sometimes people think I slept funny or I did this, and they assign a reason for it, but there can be no reason for it. And next week you might find your left breast is more swollen than your right. Don't worry about it. What you're looking for is anything expanding. If it's expanding, it's like getting bigger, and if it's red, and if it's hot, and if it's swollen, then I'm thinking, hold on a minute, is that infected? So then you need to give us a call and I need to see you, or send us a photo or something. But if it's just like one side's swollen and it's been like since the operation, or maybe it's a little bit more swollen because it's only a week, that's totally normal. Totally would not worry about it at this stage. Things will continue to settle. I don't make any judgments until around 3 months. So around 3 months, we'll have a look where we are. Now, there might still be, I'm not saying it will be fine. There might still be some asymmetries, and if there are, and if I can fix them, I will. But usually they do sort themselves out. And it's good to hear that you haven't done a lot. So continue not doing a lot, but do stuff, but don't have to do a lot. So you'll see, when's that? Wednesday? It's tomorrow. See you tomorrow. Okay, I'll see you tomorrow. We can have a proper chat about it then. But yeah, don't worry about it. It sounds like it's all fine, and it's totally normal for things to be asymmetrical. Whatever operation you're having, if you operate on both sides, things settle at different rates. So that is totally normal, and I wouldn't at all worry about it. I would certainly acknowledge it, but and you can put your mind to why it's done that. But there's often no rhyme or reason for it, and it's always the way whenever you're operating on things on both sides. So yeah, you're welcome. I'll see you tomorrow. I haven't ascertained a great amount of time. It's nearly 11:30, and so is there any other questions coming in that I can answer? I hope the trains haven't been too bad. What I plan to do is I plan to do this regularly, so I'll try and do it next week. I'm thinking Monday maybe. So if you've got any questions, get in touch, and I can do this again. You can get in touch anyway and I'll answer your questions to yourself, but I can do it to everybody on this live forum. So do get in touch, do give us an email, I'll post a comment, and hopefully we'll get some common themes and answer some questions. But I hope it's been useful. And oh, I don't know, can everyone see these? Everyone can see. Oh, I can thumbs up that. Thank you. I can hear the trains. Okay. Right, I'm going to thumbs up that. Right, okay, excellent. Well, it's worked, hasn't it? It's done well. Okay, so what I'll do is we'll look at a time, probably going to be Monday next week, because Monday's a good day for me generally, although it wasn't yesterday. So we'll sort something out for next week, and I'm going to, I can't remember how to sign. Oh, I'll finish it. Okay, right, see you soon. Bye.